we're going to do now is, and I think you've heard this morning, you've heard us talk about podiatric surgery. Well, we're very fortunate in that we've got a colleague, Susie Taylor, from who is a consultant podiatric surgeon, and she's from the Royal College of Podiatry, and she's going to talk to us about the role of a podiatric surgeon. So, Susie, hopefully you're on the call.
Yes, I'm here.
Yeah. Okay. So I'm going to hand over. I think you've got some slides.
Hello.
So we're going to let Martin do his next slide, please. All right. So over to you, Susie, and thank you very much.
Oh, thank you, Paul. Well, I mean, a lot of what I was going to say, those three fantastic colleagues have covered quite a bit of it, but I think you'll all find this quite interesting. Podiatric surgery, what is that? Well, I'm a podiatrist. It's exactly the same as my colleagues. Although during my career, I've layered my training and I've done a little bit more and a little bit more and a little bit more in different layers in depth into actually correcting foot and ankle problems. I'm going to talk to you just a little bit about that for a few minutes. I know we've got a question and answer session later as well, and you might have some questions for me. So the definition is up there on the screen, but really what I do is deal with people all day, and I say people, I mean people's problems all day, where they've tried everything non-surgical and they've got to the stage whereby nothing is fixing their foot problem, and usually that's a combination of 3 or 4 different things. It's not normally just one thing, it's a lot of things. So people come to see me. I work part-time in the NHS, part-time privately. And I do a day a week at the moment helping out at the Royal College in an advisory function as well. My role involves pretty much operating on anything that might be awry. I operate on bones, joints, soft tissues, and I do a lot of soft tissue work that needs some very fine-tuning, delicate work, such as removing tumours, mainly benign tumours, not cancerous tumours, but everything that comes out the body, out the foot and ankle, goes off to the lab, and very occasionally you do come across something that you really wish you hadn't. And this is why it's so important as podiatrists for us to work in the multidisciplinary team. We don't work on our own at all whatsoever. I wouldn't be able to do my job in that way. And so I'm going to tell you a little bit about what I do. So it's about keeping people active and at work, but it's also about keeping people socially interacting and able to go out, able to go shopping, able to see their friends, and able to walk around with shoes that fit. It's very hard if you have that foot on the left and you can see the big bump there on the side of the foot where the bone is sticking out a little bit. It's very hard to get that foot in a normal pair of shoes. Very, very hard. And quite often people have to have shoes made for them. So I really describe my work as a bit of a detective. When people come in, my first thing to do is to try and find out what's causing this problem. So I have a great array of knowledge and skills available that I use, that I've learned over the years that most podiatrists use. So my patient might need to have blood tests, they might need some sort of imaging or scan undertaken, they might need a local anaesthetic injected into a joint to see if we can knock off the pain for an hour and see where else hurts, what is the actual cause of this pain. I take a lot of biopsies from either from bone or skin or soft tissue and use something called a Doppler to undertake a vascular assessment and do some really in-depth work around nerve conduction studies, and if there's a nerve that's not firing, which nerve is not firing, and what's causing the actual problem. So we can go to slide 2. On graduating, you will start doing the nail surgery that my colleague there's explained to you and we've watched, which was a beautiful example of that, because podiatrists have access to local anaesthetic knowledge and skills, and you'll use that a lot as a podiatrist. I use it a lot as a podiatrist, and I have done since I first qualified, really on an everyday basis. And that can be from removing, I might see a young child and be removing the needles of a skin urchin out of their foot after their holiday with their family abroad 1 minute, and dealing with a teenager who's got a very infected ingrown toenail the next minute, and somebody who has a very arthritic joint or a large hammer toe deformity where their toes are deformed in some way and not sitting where they should be. Can be anything. I see children from birth up to my eldest patient was 103, and every patient that comes to the door is quite different. So that detective work and a really sunny disposition is what you need, I would say. I think probably one of the most important things is to actually be in a situation whereby you can adapt the skills that you've got. So the suturing skills, for example, that podiatrists have, you can adapt them to the different things that you need to do. If you need to put a stitch in if somebody's lacerated their foot because they've fallen off their bike, etc., you can really deal with any minor emergency that tends to come through the door. Um, I myself have had such a varied career as a podiatric surgeon or podiatrist who practices surgery. I've worked in Belmarsh and Maidstone prisons. I now work a day a week in Harley Street. There's so many things that you can do, and that's what we love about the skill spiral that is podiatry. You can start off as a generalist and then enhance your practice with a special interest. And sometimes you don't really know what that special interest is until you're actually working in the job, and then work your way up to consultant level, which is where I am. There are 105 podiatric surgeons in the UK. I've got a slide later, which I'll show you in a little while, which explains the training process, which is quite straightforward. Teja, I'll put in the chat just in that she's done the prescribing qualification. Any podiatrist, once you've qualified, you can go and do the prescribing qualification. That's fantastic. I use my prescribing every day for my patients. I write prescriptions. And again, it's quite a very useful tool to have. That means that people don't necessarily have to go to the GPs just to have an appointment for a prescription. When they're with you, you can do everything curative to that patient other than surgery. So then the patients would then come to me, and I would then talk to them about the different conservative and surgical options and go through all the risks and benefits of each type of option. And then the patient and their family, who will be providing that home support, they come to a decision on what they want to do to go ahead. The actual profession, as Paul just described, is medicine itself, particularly podiatric medicine, is developing all the time. I've just been on a course literally 4 weeks ago to undertake my second stage minimally invasive surgery. There's a lot of robotic surgery that's going on now, and there's really is quite a lot of innovation and research that's happening, because everything we do is evidence-based, and that makes the job beautiful in terms of being structured. Could we go to oh no, this is fine, we're going to stay here. So basically, what is it about my job that I like that's a structure? And it really is very regimented, it's very defined, and that's lovely, because for me as a clinician, it takes the stress off of it. I know that when my patient comes in, the first thing we're going to do is confirm the consent. Then we're going to mark the leg that we're going to operate on. Then we're going to mark the toe. Then we're going to define the patient's allergies, medications, etc. Then when the patient comes to theatre, it's not just me there. There is a whole team of people. I work with at least 3 support workers, and we work together. And because it is so structured, every instrument that you're going to use is ready for you. Every order in which you're going to use those is there. And that's really a lovely way to work, because it allows you to have a process that eliminates as much of the risk as humanly possible. And that's really nice. And when things go wrong, which is very, very, very rare, but can happen, you can see where your process didn't follow and how that happened and how that went wrong, which is a really nice way to be. I train a lot of other people. So if we go to slide 3, and that being a teacher,
Susie,
yeah,
I'm going to need to move you along if you don't
yeah,
mind. Is that
yeah,
okay?
sure.
Thank you. Thank you.
If you go to slide 3, we've got there the map of in England of all the training centres, and you can train you can either self-fund your training, or there's an apprenticeship programme for your training. And that, sorry, I put the old slide in by mistake. That should say we have an annual conference with a surgical track, and this year it's November and it's in Harrogate, and everyone is welcome. And then my last slide, if we can go to the 4th slide, is the training career pathway for podiatric surgery. It's quite small. If you'd like to know more about it, this is on the Royal College of Podiatry website. So it's on here, and I'm very happy for people to email in with any questions they've got, and maybe arrange a placement for people if that's what you would like. If you find that having a placement with a podiatrist to find out more about what they do would be useful. Okay, that's super. Thank you, Paul.
No, thank you, Susie. And that's really, really helpful because I think what it shows is there's an opportunity for a career after you've done your initial qualifications as a podiatrist. Right.